My name is Rajesh Bayana, and this is the first video of this series. This video and the other videos in this series are designed to teach you so that you can truly understand the concepts that are going to help you start looking at CTs on your own as soon as possible. This video and the entire series are meant to be practical over anything else. Ultimately, this should serve as a great starting point. The rest of the website is designed to help you navigate all the resources that are out there in order for you to learn what you want to learn and what you need to learn in the most efficient way possible. So this first video is intended to give you a very succinct introduction to CT. And you might think to yourself that you should skip some of these concepts in order to spend more time on more advanced concepts right away, but learning these basic concepts is crucial to have a strong base that you can build on. A lot of what you're going to learn in the future is going to be based on these basic concepts. So before we get started, I want to make the point that you shouldn't kill yourself with the details here. Don't try to memorize things. A lot of the specific examples are meant to be illustrative. Just focus on understanding the most basic principles, and we'll build on that later. So we start here with an X-ray image. The main point here is that to create an X-ray image, an X-ray beam is emitted through something. In this case, it happens to be someone's chest, and then it's detected on the other side. How black or white an area on the film is depends on the density of the tissues between the emitter and the detector at that point. For example, if I emit X-ray beams here, where there's mainly lung, which mainly contains air and is therefore low density, most of the beams are going to get through, and it's going to display on the X-ray as black. If I shine X-ray beams through this point here where the heart overlies the spine, very few beams are going to get through to the detector because these are dense structures. This is going to show up as white. The takeaway point here is that low density areas are going to look blacker and higher density areas are going to look whiter. CT is more complex than X-ray, but the same principles apply. More dense structures are going to look whiter and less dense structures are going to look darker. Let's focus on the bare bones practical points here. In the most basic terms, CT shines X-rays through the body from all angles, and it's able to determine the density of every single part of your body. It calculates the density of tiny voxels. A voxel is like a 3D pixel or a volume pixel. That's where it gets its name from. Picture the body as being made up of millions and millions of tiny cubes. CT calculates the density of all these little cubes of tissue and then displays that density. How dense a given cube or voxel is can be graded on a scale, and that scale is called the Hounsfield unit scale. Okay, so I can't emphasize how important it is to burn this into your brains. It's going to come up time and time again. Practically speaking, Hounsfield units range from -1,000 to +1,000. -1,000 being the least dense and +1,000 being the most dense. By convention, pure water is assigned a value of 0 Hounsfield units. Also, by convention, air is assigned a value of -1,000 Hounsfield units. Everything else that we image is calculated in comparison to these two numbers. The basic radiographic densities are extremely important to know. Again, -1,000 is air and 0 is water by convention. If we add something to the water like red blood cells, the density is going to get a little bit higher than that. Things that are very, very dense like cortical bone or metal are near +1,000. Soft tissue like liver and muscle will depend on the particular soft tissue. But for simplicity's sake, we're going to use a ballpark number that's easy to remember, +50. So now I'll ask you a question. What's more dense, fat or water? When I've taught this in the past, nearly everybody thinks that fat is more dense than water, but that's not true. Think about it. If you mix oil and water, oil floats on water because it's less dense. So fat's actually less dense than water. And a nice easy ballpark number to remember is -100. Okay, so burn this into your brains. I can't emphasize how important it is to understand this basic concept and know these ballpark figures. It's going to come up time and time again as we move forward. So, just a little bit of an aside, many of you guys might know this already, but CT scans are generally obtained in axial slices. And then you can create reformats in any plane that you want from that source axial information. This image shows the most common reformats that are made, the sagittal reformats and the coronal reformats, and it shows what they mean as well. So, this is the radiologist over here, and this is his screen. When you're looking at an axial slice of a CT scan, you have to picture the patient like this. The head is in the screen, and their feet are towards you. That way, when you're looking at an axial slice of a CT scan like this, you picture the head behind your screen, the feet towards you, the patient's right is over here, the patient's left is over here, the anterior part of the body, in this case the belly, is over here, and the patient's back is over here. This is the spine. Okay, so now let's move back to talking about the basic radiographic densities, Hounsfield units, and then we'll talk about some clinically important applications of Hounsfield units. So this is a CT abdomen without contrast, where we can actually see all the basic radiographic densities. So we have fat out here, that's darker. We have air out here, that's even darker. We have soft tissues in the spleen, in the liver, in these muscles along the abdominal wall. We have bone here as well. And just to show you some of these densities in number format that we've been looking at, I've put an ROI or a region of interest marker on some of these areas. What that does is it averages the density or the Hounsfield unit number within that particular selected area. So we'll start here. I've selected in the upper right corner of the image, I've selected an area outside the patient, which is air, which we said by convention is about -1,000. So here if you look at the average number, that's what we're looking at. And so that shows -998. Okay, moving up in more to the higher density structures, we have the subcutaneous fat, which is shown as very dark tissue right here. The average here is -125. Our ballpark number was -100. Moving up, we can move down towards the bladder, where it should mainly be urine or close to water there, and we have a lower density, about 10 or 9 or 10. And the soft tissues that we've selected up here are the liver and the spleen. So the liver here measures an average density in that area of 29 Hounsfield units, and the spleen here measures an average of 50. Okay, and then we have selected a rib here, where we've selected a little bit of cortical bone, but also some of the bone within, and it's a lot higher of a number. So the Hounsfield unit, or the density here, is 538 Hounsfield units. So quick pearl here, quick aside, the principle of CT here is that, especially of the abdomen, is that all this fat, which is lower density and therefore darker, surrounds these organs and tissues within the abdomen and allows us to evaluate those structures better. Okay, the liver and the spleen on a non-contrast scan, the liver should be of a higher density. A normal liver should have a higher density than the spleen. When the liver is of lower density than the spleen, you have to think, why does this liver, or why is this liver of lower density? The most common answer is that this patient has a fatty liver. So it's direct application of the fact that fat is less dense. Therefore, when you have a fatty liver or fatty infiltration of the liver, it's going to show up as being less dense, which it does here. So this particular patient does have a fatty liver. You can actually see that with your eyes as well, as this is a darker shade of gray. Another principle that we can quickly talk about is the principle of fat stranding. So if you look at the fat, where my mouse is here in the intra-abdominal fat, it's very clean. It's just fat. If you look at the fat here around the kidneys, it looks dirty. And the reason why it looks dirty is because there is fluid or edema in that particular portion of the fat. And that tells us that there's either fluid or inflammation in that region. In this particular case, it's surrounding the kidney, so we want to focus our search on the kidney. When we look at the kidney and we follow the collecting system, which is right here, if you just follow it down, you'll notice that there is a stone there. So this particular case, as an aside, is an obstructive ureteric stone causing mild hydronephrosis, which can be seen by a slightly dilated collecting system, and there is stranding around the kidney that we can see, and that suggests that it's acute. And if you look at the kidney size, this one looks a little bit bigger because it's a little bit edematous. Okay, so now we understand the basic radiographic densities. We have ballpark figures for them, and we've demonstrated them on a real non-contrast abdominal CT scan. So now let's apply it. So, these actual numbers are important, and I'll give you two clinical examples here. Okay, so the first one is a patient who was in a car accident. So this is a CT scan of the abdomen. It's with contrast. And I'll scroll through it. On the right here is the liver. On the left here is the spleen. This is the aorta. This is the stomach. Okay? That's just to orient you. As I scroll inferiorly or towards the feet or towards the reader or the radiologist, as you know, the liver is wedge-shaped, and this is the inferior portion of the liver. As I scroll down, you'll notice that in between the liver and the kidney, there is some fluid. Okay, and this fluid is in the hepatorenal recess, which is a very clinically important space. It's one of the places that you look for when you do a FAST exam because it's one of the dependent recesses in the abdomen. Okay, because this is a trauma, it's important to know what this fluid represents. So this fluid that sits here in Morrison's pouch, which is another name for the hepatorenal recess, it could represent ascites in a patient who happened to have ascites beforehand, or it could represent hemoperitoneum or blood. So in this particular situation, what we do is we check the density of it using an ROI as we've done previously, and the density measures in that region to have an average of 36 Hounsfield units. So 36 Hounsfield units is too high to just be simple ascites, which would be closer to 0, usually between 0 and 20, we'll say. In this case, this represents blood or hemoperitoneum, and as a result of knowing that there's blood surrounding the liver here, we have a much higher suspicion for injury to the solid organs, especially the liver. So when we look at the liver more closely, and we'll have the help of the arrows, you see this linear hypodensity here that we can follow. That's going into the gallbladder fossa. This is the gallbladder here. That represents a laceration of the liver. Okay, so it's a nice example of a subtle laceration that is made more obvious by seeing that there's actually blood rather than just simple fluid surrounding the liver. Okay, so here's a second example. So here we have a single CT slice of the head, and we notice a very dark spot in the midline on the left of the falx that looks very dark here. So, what does this represent? In order to determine what it represents, we can measure the density. And when we put an ROI on it, we notice that the density is negative 106.7 Hounsfield units. So we know that this is fat. So this represents fat rather than air. This patient happened to have fatty deposition along the falx, which is not uncommon. If the patient had been involved in a trauma and you had just looked at this image, you might think that this dark spot represents air, and calling it a focus of air in the brain or pneumocephalus has very strong clinical implications. Again, this is another example of why it's very important to understand the basic principles of Hounsfield units and basic radiographic densities. So, now that we know the importance of understanding the basic densities, we need to understand windowing, a concept that's crucial to understand before starting to look at CT scans. You might have heard the terms lung window, bone window, etc., but it's important to understand what these terms actually mean. So far, in the simplest terms, we understand that CT scans measure and display the densities of each voxel of tissue. When we look at a CT scan, actually seeing with our own eyes the difference in densities can help us identify pathology. For example, a low density lesion in the liver in a patient with colon cancer might represent a metastatic deposit, and we need to be able to detect that difference in density with our eyes. However, our eyes can only detect a finite number of shades of gray. Some people say that the number of shades of gray that we can detect or differentiate is 30. But who cares what the actual number is? If we were to distribute all of the different shades of gray that our eyes can detect evenly over the entire scale of densities that we know, from air at -1,000 to dense cortical bone near +1,000, then a simplified version of the distribution of these shades of gray might look something like this. But the vast majority of the tissues that we're evaluating or looking at, whether it be in the brain or the abdomen, range from 30 to 130 or so all up here. And if we use this particular distribution of shades of gray, all those tissues that we're trying to evaluate kind of look similar, like one or two different shades of gray. And that means that when we're looking for subtle differences in density, we won't be able to see it with our own eyes. So the principle of windowing is how we distribute these shades of gray that we can differentiate, and how we can take advantage of this distribution to make it possible to see clinically important differences in density. So there are two numbers that define any window, okay? And these two numbers are often displayed at the bottom of a CT image, and the two numbers are the window width and the window level, usually displayed as a W for window width and an L for window level in the bottom corner of the screen. So the quote-unquote distribution of shades of gray that we have on this slide ranges from -1,000 to +1,000. The shades of gray are distributed over 2,000 Hounsfield units, so the width or the window width is 2,000. The window level is the number that the distribution is centered on. In this case, it's 0. A width of 2,000 and a level of 0 defines this particular window. So let's pull up an axial CT slice using this particular window, which we said is not that good at looking at the soft tissues. So here is a single slice of the abdomen with that particular window. This is a kidney, this is a kidney, and over here on the right side of the image is where I want you to focus. This is the bottom of the liver. Okay, with this particular window, the liver looks pretty homogeneous. You would just scroll right by it, of course. So now let's change the window. Let's distribute the shades of gray differently. An important point is that no matter what, a given axial CT slice displays the same density information. When we change the window, we do it to allow our eyes to pick up important density differences that indicate abnormalities. Here, we've changed the window so that all the shades of gray are distributed amongst the level of the soft tissues. The principle is that our eyes will now be able to pick up differences in density at this level because they're displayed as more different shades of gray, as you can see here. If there's something in the liver and the spleen, we have a better chance of seeing it with this window than the last one. So here the window is centered at 50, or the level is 50, and the width is 400. Okay, so everything below -150, which is here, is going to be black, and everything above 250 is going to be completely white. So let's look at the same CT scan image on this particular soft tissue window. So now when we look at the liver, if we focus on the bottom of the liver here, we actually see that there's a rounded hypodensity within the liver. It's somewhat subtle, but you can see it. So again, here's a soft tissue window that we had used previously on the last CT image. Let's narrow the window width even further. Now, with this window, the shades of gray are distributed over an even smaller range. Okay, the width is now 150. So, differences in density will be even more apparent. The reason for this is that the differences in density within this narrow range will differ quite a bit with respect to the shade of gray that they're displayed as. Again, everything below will look completely black, everything above will look completely white. So let's pull up a CT slice with this particular window. So this same slice, the hypodensity in the liver looks even more conspicuous. We can compare them side by side, and we can really see how much more conspicuous it is when we narrow the window. But focus on the principle. We need to understand that windowing is very important moving forward to help us detect clinically important abnormalities, including strokes in the brain, pulmonary emboli in the chest, and free air in the abdomen. These are just a few examples of things that can be easily missed if you don't window properly. Here are some examples of various preset windows with the width and level displayed. Again, don't kill yourself with the details. This is for reference. Don't try to memorize these. Just understand the basic principle of windowing for now. Later, it's going to be good to keep some ballpark numbers in mind, but that will come with time. So let's change gears a little bit here and add IV contrast. Contrast completely changes the game, and there are a lot of things to know about IV contrast. But the very basic principle is simple. We inject contrast that is iodinated into the venous system or intravenously. We wait a certain amount of time, and then we image the patient. How long we wait after we inject before we image will determine what phase we are in. In other words, how long we wait will determine where the contrast is going to be in the body. Where the contrast is important, and we want to take advantage of particular phases to answer particular clinical questions. For example, if we want to evaluate for an aortic dissection, we want the contrast to be in the aorta. If we want to evaluate for a pulmonary embolism, we want the contrast to be in the pulmonary arteries. So let's talk about the most commonly encountered phases that everyone should know. We can worry about the specifics later. So we inject contrast or a contrast bolus into the venous system. The contrast drains into the right heart. It goes through the pulmonary artery or the PA into the lungs. From the lungs, it comes back to the left heart. From the left heart, it is pumped into the aorta and then the other arteries. The first basic phase that we're going to talk about is the arterial phase. That is the phase where the contrast is predominantly in the arteries. And you can have early and late arterial phases, but for now, let's just say the arterial phase, and we wait generally about 20 to 40 seconds after injection to get a good arterial phase. The blood then goes from the arteries into the various organs like the liver, the spleen, as well as the bowel, and then from certain organs it drains into the portal venous system. Okay? And when most of the contrast is in the portal veins, that's the portal venous phase. And we generally image 80 seconds after the injection of the contrast bolus to image in this particular phase. And then you can also do delayed images, where you wait about 6 to 10 minutes before you image. By this time, the contrast has made it through the kidneys and is now in the collecting system. The delayed phase can be done for one of many reasons. One of the reasons might be to evaluate the collecting system itself. On the left here, we have an example of an arterial phase image. The aorta is here, and it's very bright because most of the contrast is within the arterial system. There are other clues that you can look for to determine what phase you are in when looking at an abdominal CT, such as the appearance of some of the organs, mainly the kidneys and the spleen. The spleen is seen on the image over here on the left, and you can see that it has a very heterogeneous appearance. This happens normally in the arterial phase because of the different types of pulp in the spleen. So don't be alarmed when you see a spleen looking like this on an arterial phase. It's normal. On the right here, we have an image that was taken in portal venous phase. The portal vein, which is here, is bright. You'll notice that the spleen here is homogeneously enhancing. The portal venous phase is what we use for general abdominal scans because it helps evaluate most of the abdominal organs the best. Okay, so take-home points. If you take away anything from this talk, it should be the following. 1. Remember your densities. So the Hounsfield unit scale is something that will come up again and again. So knowing it and knowing its applications is key. A negative 1,000 is air, 0 is water, positive 1,000 is bone and metal, fat is around negative 100, soft tissues are around 50-ish. Second point, windowing. So remember, our eyes can only differentiate a certain number of shades of gray. The concept of windowing describes the idea of distributing these shades of gray differently in order to be able to actually visualize clinically important differences. Windowing appropriately is extremely important, as we'll see moving forwards. As I mentioned, it can be very easy to miss strokes in the head, PEs in the chest, and FREER in the abdomen if you don't window appropriately. 3 phases. Very briefly, we talked about the basic concept that is when we inject IV contrast, we wait a certain amount of time, and then we image. And we're going to discuss a lot more about phases when we talk about each of these systems moving forward. So that concludes the first talk. I hope that this was helpful, and I hope to see you guys again soon. Thanks.